Good morning, everyone. Welcome to Equity, Ethics, and Maternal Health in Tennessee. This webinar is brought to you by the Tennessee Healthcare Campaign. My name is Judy Reutman, and I am the Executive Director. Tennessee Healthcare Campaign is the premier statewide healthcare justice organization in Tennessee. We believe that all people in Tennessee deserve access to affordable, equitable, quality healthcare. Since 1989, we've advocated for programs and policies that improve the health and well-being of Tennesseans. And that includes our victory very early on in pushing for TennCare coverage of pregnant women back in the 1990s, all the way up to our current advocacy for Medicaid expansion today. In addition, we are a nonprofit insurance agency. Our licensed agents help people get the best coverage for the lowest price in TennCare and healthcare.gov plans. We are small but mighty due to the incredible commitment of time, talent, and resources by our many volunteers. If you are new to Tennessee Healthcare Campaign, I urge you to check out our website and sign up to get involved. To get us started on today's webinar, I'd like to introduce you to Jacqueline Dalton, Tennessee Healthcare Campaign board member and the chair of our education committee. She was a presenter at last year's annual conference and is serving as our moderator today. Jacqueline is currently the director of community engagement at the national nonprofit Health Leads and a Middle Tennessean native with a passion for health equity and public health. Thank you, Jacqueline.
Thank you, Judy, and good morning, everyone. I'm so excited to be here with you all for this special conversation around maternal health. One of the things that we know about maternal health is that it's really important and that mothers are typically known as the nurturer of the family. And I like to think in public health of the mother as maybe the gatekeeper, and the mother's health actually may be an indicator of the rest of the family's health status. So one thing that's really important is making sure that mothers have the opportunity and the access to stay healthy, and a big part of that is having access to healthcare. So for this very special discussion today, we have three wonderful presenters, which we have the pleasure of having. Briana Perry from Healthy Free Tennessee, Emily Fawcett from the Family and Children's Services, and also Ricky Martin, who's a doula at Birth Strides. During this important conversation today, we'll focus on several issues around the ethics of maternal health, understanding current mandates, and also understanding policies that impact the health equity of maternal health in Tennessee, particularly for women of color. So first, I'm going to introduce to you, the first speaker that we'll hear from today is Briana Perry. Briana Perry is the co-executive director of Healthy and Free Tennessee, and which is a statewide network working to promote sexual and reproductive health and freedom. She graduated from Vanderbilt University with her BA in sociology and women's and gender studies in 2013. Well, as an undergrad, Briana developed a passion for Black feminism and community organizing with a focus on Black women and reproductive freedom. Before obtaining her master's degree, she taught English, science, and social studies for 2 years in her hometown of Memphis, Tennessee. In 2015, she returned to Nashville as a graduate at the Peabody College and completed her Master's of Education in Learning, Diversity, and Urban Studies. In 2016, Briana became an advisory committee member for the National Bailout Collective, which is a coordinating committee that with the official Black Lives Matter Memphis chapter. As a board member in this role with the Brooklyn Heights Community Garden, she's also a trained birth doula, and her interests range from or includes Black feminism, abolition, and reproductive justice, and all the intersections of those things. So I'm so glad to have you, Briana. I'll turn it over to you.
Yeah, thank you so much for that introduction, and thank you to the Tennessee Healthcare Campaign for the invitation. So I'll go ahead and share my screen. Now also, I'm going to time myself to talk about the state of maternal health in Tennessee. So this includes some statistics and also some advocacy around changing the state of maternal health. So just to begin, around 50%, and some years it's more than 50%, but it's I think on average around 50% of births in Tennessee are covered by TennCare. But the Tennessee legislature has voted not to expand Medicaid. And just thinking about that, and also as we are still in the midst of a pandemic, what that means for folks, for pregnant folks, but just thinking about that percentage and that our legislature has not expanded Medicaid. So getting into some of the statistics. So starting off with inadequate prenatal care. So it's really clear, with medical research that it's necessary for folks to receive prenatal care to have the healthiest pregnancies, to improve birth outcomes. And so these data are from March of Dimes, and inadequate prenatal care is defined as pregnancy-related care beginning in the 5th month of pregnancy or later, or less than 50% of the appropriate number of visits. And just some points to pull out. So in 2019, about 1 in 6 infants was born to a woman receiving inadequate prenatal care. It's something else because I think around this conversation, when it comes to equity in maternal health, sometimes age as a point to think more deeply about, sometimes it's overlooked. And so when it comes to receiving inadequate prenatal care, mothers under age 20 had the highest rates compared to other maternal age categories. So thinking about conversations around supporting young people who are parents, who are mothers, the conversations are often around, preventing teen pregnancy, but we need to ensure that mothers under age 20 are receiving care, as the statistics show, that they had the highest rates of inadequate prenatal care. And then there's late or no prenatal care, which can be, self-explanatory, like folks who are receiving care in the 3rd trimester, or no pregnancy-related care at all. And so between 2017 and 2019, American Indian / Alaska Native mothers had the highest rate at 12.5%, followed by Black mothers at 9.8%. And these are, both women of color who either receive late prenatal care or no prenatal care. And just thinking about the impact on those mothers, their families, their babies, when you don't receive prenatal care, or it's late prenatal care, not being able to diagnose some of the conditions that emerge during pregnancy, and that coming up, when somebody goes into labor and delivery, and how that complicates things. And so to pull out the preterm birth rate, so in Tennessee, the preterm birth rate among Black women is 44% higher than the rate among all other women. And so this is a March of Dimes, report card. And I wanted to highlight some states. So overall, Tennessee gets a D-. And I believe the preterm rate, birth rate is around 11%. So in Davidson County, where I live, their grade is D+, and so there was no change. Hamilton County, which is around the Chattanooga area, they have, received a D+ over this last year, which was an improvement. And the rate is currently 10.5%. Knox receive a D+, and their preterm birth rate is 10.4%, which was worse. And Shelby County has an F, and their preterm birth rate is 12.4%, and this was considered an improvement. And so just thinking about like the demographics, like I'm originally from Memphis, Shelby County, it's a majority Black city, and just talking to different birth workers, midwives, doulas, just thinking about access to prenatal care for Black women, it's just abysmal in Memphis, and I think we see that the rates aren't necessarily better across the state. And just moving a little bit into what care looks like in rural Tennessee. And so Tennessee has a lot of rural areas. And we also have the highest rate of rural hospital closures in the country. And so when rural hospitals like are about to close, the maternal ward is the first to go. And so thinking about that, and this statistic is from Tennessee Justice Center, article that they put out about like some policy recommendations. But 47 of Tennessee's 95 counties lack access to an OBGYN. So just thinking about like what maternal health care looks like for folks who are in rural places, what resources are available to them, what do their birth outcomes look like? And so as we think about improving maternal health care access, thinking about doing that for people who live in rural areas as well. And also there are like folks of color who live in rural areas in Tennessee too. And I think sometimes that's overlooked as well. And so, of course, as we think about this national conversation around maternal mortality, as we are, coming out of Black Maternal Health Week that was last week, a week that started in 2018, to really recognize the state of maternal mortality in this country and the crisis that we're in. And so this graphic is from the Tennessee Maternal Mortality Review Committee, and that committee was established in 2016. Representative Harold Love, a representative out of Nashville, worked, with I think a few doctors, but in particular, Dr. Connie Graves, to really establish a maternal mortality review board in Tennessee, because how the tracking was done beforehand was not consistent. It was a lot of data around infant mortality, but not a lot of data and thinking about like, hey, like when it comes to the death certificates, tracking if it was related to pregnancy complications. And so this graphic is thinking about or referring to the report that was released in 2020, so last year, but there is a new report that has come out this year, and I definitely encourage folks to review it. And so in the 2020 report, they analyzed data in deaths from 2017 and 2018. And so they found that 46 Black women in Tennessee died while pregnant or within 1 year of pregnancy during this period, 2017 and 2018. And at the bottom, the rates are comparable to the national rates. So in Tennessee, Black women are 3 times as likely to die from pregnancy complications than white women. And that rate, again, is comparable to nationally, or what we see nationally, because Black women are 3 to 4 times more likely, depending on what state we're looking at. And so at the bottom, and this is the part that really stands out to me, 100% of pregnancy-related deaths to Black women during this time period were determined to be preventable. So not, 50%, not 40%, but 100% of pregnancy-related deaths to Black women, not this specific category of women, were deemed to be preventable. So again, you can read the report for this current year and find this graphic on the website. But yeah, just really thinking about like, what are we doing to improve these outcomes for Black women, as we know that they experience these disparities. And I just want to end on advocacy that's being done. And so Healthy and Free Tennessee, the organization that I'm at, focuses on advocacy and policy work. So we're not direct services, we're not a clinic, but we are trying to change the state of maternal health at the Tennessee legislature. So I want to highlight some bills and a few resolutions that came up this legislative year, and just kind of giving the story behind some of them as well, because given the state of maternal health, you would think that there would be this like outpour of concern, and what we see is that there are a lot of questions and hesitation from Tennessee legislators. And I apologize if you hear my dog in the background. She's really, having a party over here. So to begin, Healthy and Free worked on this first piece of legislation, but thinking about a doula recognition resolution. And so our goal is to work with community-based doulas and eventually get them reimbursed by TennCare. And so other states are considering doing this. And Tennessee is a state that has introduced legislation around this, but we also want to be mindful that a lot of the reimbursements when it comes to doula care is tied to certification. And so, just a little quick background when it comes to doula care, we know that doulas and research shows that a doula just being present in a room with a birthing person, significantly increases birth outcomes. And thinking about how this can be an intervention when it comes to improving maternal health and trying to chip away at the maternal mortality crisis. And so as a first step, there are a lot of conversations that need to be had about what is a doula, what is the care they provide. And that's something that we found as we were working on this resolution, that people have questions. People, sometimes are hard to, it can be difficult for folks to what is the difference between a doula, a midwife, and an OBGYN? And so we're doing some education around that. And luckily, and thankfully, this resolution passed. And again, it's a first step. We are committed to this for the long haul, with the ultimate goal being to get community-based doulas reimbursed by TennCare, and also thinking about certification differently, right? Certification, and I'm a trained birth doula, getting certified by DONA, it can be a lot of money, over $1,000. And when we think about who's disproportionately impacted by these disparities, and it's Black and Brown women, and we also know it's important for folks to have people who look like them, supporting them and providing these services and care. It can be very cost prohibitive for community-based doulas to, come up with over $1,000 to become certified. So that's something else that I want to uplift, the Healthy and Free, in collaboration with a few birth collectives. They're trying to think about certification in a different way and see if we can, do a study to think about what are the core competencies that are needed for doulas to be certified. And also, thinking about collectives in Tennessee being able to provide their certification instead of people having to go to a donor and it's going to cost thousands of dollars. Other pieces of legislation, and that was sponsored by Representative Wanda Lamar, and you'll see that she has sponsored quite a bit of legislation related to intervening on maternal health in Tennessee, and so her name is up here, in every piece of legislation. And so there is, she introduced a task force, a bill related to a task force to study and report on Black preterm births and infant mortality. So, thinking about the data that I shared related to preterm births and how Black women are disproportionately impacted by that. Unfortunately, this bill was sent to summer study. And for folks who aren't familiar with summer study, that's, a way for a bill to die. And so this is sponsored by Representative Wanda Lamar and Senator Ed Jackson. Representative Wanda Lamar also introduced a resolution to recognize Black Maternal Health Week, by Tennessee. So it's a week that's recognized nationally, and other states have established this week as worthy to be recognized. And that's something that failed a few weeks ago. And lastly, Representative London Lamar introduced a bill related to implicit bias training for maternal and perinatal health programs, and thinking about the creation of a perinatal patient bill of rights. So patients know, what their rights are when they're thinking about giving birth. And again, unfortunately, this was also sent to summer study, and this was sponsored by Representative Wanda Lamar and Senator Jeff Yarbrough. So I'll stop right there, and I know I'm at time, just to give a few statistics about the state of maternal health. Think about how or show how it is disproportionately impacting Black and brown women, some advocacy efforts that are being done, but also to recognize that it has been a challenge to get the political will to really center this issue in Tennessee.